Hello and welcome to our channel. In this comprehensive video, we dive deep into challenging nursing questions related to renal dialysis, tailored for both NCLEX and pre-metric exams. Join us to enhance your knowledge and critical thinking skills as we provide detailed answers and thorough rationales to help you succeed in your nursing career. Whether you're a student preparing for exams or a healthcare professional seeking to strengthen your expertise, this video will be an invaluable resource. Let's start. Question 1. A patient with end-stage renal disease ESRD is receiving hemodialysis. During the session, the nurse notes that the patient's blood pressure drops significantly. What is the nurse's immediate action? A. Administer a hypertonic saline solution. B. Stop the dialysis treatment and notify the healthcare provider. C. Increase the dialysis machine's blood flow rate. D. Administer an antihypertensive medication. Answer 1. B. Stop the dialysis treatment and notify the healthcare provider. Rationale: a significant drop in blood pressure during hemodialysis may indicate hypotension, a common complication. The nurse's immediate action is to stop the dialysis treatment and notify the healthcare provider for further evaluation and intervention. Administering hypertonic saline or antihypertensive medications is not the initial response to a drop in blood pressure during dialysis. Question 2. A patient on peritoneal dialysis reports cloudy dialysis effluent. What is the nurse's priority action? A. Administer an antibiotic as ordered. B. Encourage increased fluid intake. C. Assess for signs of peritonitis. D. Document the finding in the patient's chart. Answer 2. C. Assess for signs of peritonitis. Rationale: cloudy dialysis effluent in a patient on peritoneal dialysis can be a sign of peritonitis, an infection of the peritoneal membrane. The nurse's priority is to assess the patient for signs of peritonitis, such as abdominal pain, fever, and an elevated white blood cell count. Administering antibiotics, encouraging fluid intake, and documenting the finding may be necessary but should follow the assessment for peritonitis. Question 3. A patient with chronic kidney disease is prescribed a phosphate binder. The nurse understands that the purpose of this medication is to A. Increase calcium levels. B. Lower serum phosphate levels. C. Improve erythropoiesis. D. Enhance potassium excretion. Answer 3. B. Lower serum phosphate levels. Rationale: phosphate binders are prescribed to lower serum phosphate levels in patients with chronic kidney disease. These medications bind to dietary phosphate in the gastrointestinal tract, reducing its absorption and helping to control hyperphosphatemia, increasing calcium levels, improving erythropoiesis, and enhancing potassium excretion are not the primary purposes of phosphate binders. Question 4. A nurse is caring for a patient with end-stage renal disease ESRD, who is receiving peritoneal dialysis. The nurse observes that the dialysate return is slower than usual. What is the nurse's initial action? A. Administer a diuretic to the patient. B. Reposition the patient to the opposite side. C. Check for kinks or clamps in the tubing. D. Increase the dwell time of the dialysate. Answer 4. C. Check for kinks or clamps in the tubing. Rationale: a slower than usual dialysate return may be caused by kinks or clamps in the tubing. The nurse's initial action is to check for these obstructions and correct them to ensure proper fluid exchange during peritoneal dialysis. Administering a diuretic, repositioning the patient, and increasing the dwell time are not appropriate actions for addressing this issue. Question 5. A patient with end-stage renal disease ESRD is prescribed erythropoietin-stimulating agents, ESA letters. The nurse understands that the purpose of these medications is to A. Increase serum phosphate levels. B. Stimulate red blood cell production. C. Lower blood pressure. D. Reduce fluid retention. Answer 5. B. Stimulate red blood cell production. Rationale: erythropoietin-stimulating agents ESA letters are prescribed to stimulate the production of red blood cells in patients with chronic kidney disease, especially those on dialysis. These medications help manage anemia, a common complication in ESRD. Increasing serum phosphate levels, lowering blood pressure, and reducing fluid retention are not the primary purposes of ESA letters. Question 6. A patient receiving hemodialysis has a fistula in the left arm for vascular access. What nursing action is essential to maintain the patency of the fistula? A. Avoid using the left arm for blood pressure measurements. B. Apply a warm compress to the left arm before dialysis. C. Administer anticoagulant medications routinely. D. Encourage the patient to perform left arm exercises. Answer 6. Avoid using the left arm for blood pressure measurements. Rationale. To maintain the patency of a fistula, it is crucial to avoid blood pressure measurements for insertions or any constrictive devices on the arm with the fistula. These actions can compromise blood flow and increase the risk of complications. Applying warm compresses, routine anticoagulant administration, and encouraging arm exercises are not specific to maintaining fistula patency. Question 7. A patient on peritoneal dialysis reports persistent pain in the abdomen during inflow and outflow phases. What is the nurse's priority action? A. Administer an analgesic as ordered. B. Document the patient's report in the chart. C. Check for signs of peritonitis. D. Increase the volume of dialysate during exchanges. Answer 7. C. Check for signs of peritonitis. Rationale. Persistent abdominal pain during inflow and outflow phases of peritoneal dialysis may be indicative of peritonitis, an infection of the peritoneal membrane. The nurse's priority is to assess the patient for signs of peritonitis, such as fever, abdominal tenderness, and cloudy dialysate, administering analgesics, documenting the report, and increasing the volume of dialysate are secondary actions and should follow the assessment for peritonitis. Question 8. A patient with chronic kidney disease is prescribed a loop diuretic. The nurse understands that the primary purpose of this medication is to increase potassium excretion, B. Improve calcium absorption, C. Enhance fluid retention, D. Reduce fluid volume. Answer 8. D. Reduce fluid volume. Rationale. Loop diuretics are prescribed to reduce fluid volume in patients with kidney disease by increasing the excretion of water and electrolytes. They are especially effective in managing fluid overload, increasing potassium excretion, improving calcium absorption, and enhancing fluid retention are not the primary purposes of loop diuretics. Question 9. A patient undergoing hemodialysis develops muscle cramps during the procedure. What is the nurse's initial intervention? A. Administer a prescribed muscle relaxant. B. Increase the blood flow rate on the dialysis machine. C. Administer an bolus of normal saline. D. Stop the dialysis session and notify the healthcare provider. Answer 9. C. Administer an bolus of normal saline. Rationale. Muscle cramps during hemodialysis may be a sign of fluid and electrolyte imbalance. The nurse's initial intervention is to administer an bolus of normal saline to address potential hypovolemia and correct electrolyte imbalances, administering a muscle relaxant, increasing the blood flow rate, and stopping the dialysis session are not the initial actions for managing muscle cramps during hemodialysis. Question 10. A patient with end-stage renal disease ESRD is prescribed a low-phosphorus diet. Which food item should the nurse advise the patient to limit due to its high phosphorus content? A. Oranges. B. Eggs. C. Rice. D. Spinach. Answer 10. B. Eggs. Rationale. Eggs are high in phosphorus and should be limited in the diet of a patient with end-stage renal disease ESRD to help control serum phosphate levels. Oranges, rice, and spinach are lower in phosphorus and may be included in the diet in moderation. Dietary phosphorus restriction is essential in managing complications associated with ESRD. Question 11. A patient undergoing peritoneal dialysis reports experiencing chest pain, shortness of breath, and sudden onset of anxiety. What is the nurse's immediate action? A. Administer oxygen to the patient. B. Assess the patient's blood pressure. C. Stop the peritoneal dialysis and call for emergency assistance. D. Encourage the patient to take deep breaths. Answer 11. C. Stop the peritoneal dialysis and call for emergency assistance. Rationale: chest pain, shortness of breath, and anxiety may indicate a pulmonary embolism, a serious complication during peritoneal dialysis. The nurse's immediate action is to stop the dialysis and call for emergency assistance, administering oxygen, assessing blood pressure, and encouraging deep breaths can follow. But addressing the potential life-threatening situation is the priority. Question 12. A patient with end-stage renal disease ESRD is prescribed apoetin alpha epigen. The nurse explains to the patient that this medication is given to stimulate appetite, B. Prevent infection, C. Stimulate red blood cell production, D. Reduce serum potassium levels. Answer 12. C. Stimulate red blood cell production. Rationale: apoetin alpha epigen is a medication prescribed to stimulate the production of red blood cells in patients with end-stage renal disease ESRD and anemia. It does not affect appetite, prevent infection, or reduce serum potassium levels. Question 13. A patient on hemodialysis complains of severe itching, particularly on the back. What action should the nurse take? Administer an antihistamine as ordered. B. Document the patient's complaint and continue monitoring. C. Assess for signs of hyperkalemia. D. Evaluate the dialysate bath temperature. Answer 13. D. Evaluate the dialysate bath temperature. Rationale: severe itching, particularly on the back, may be a sign of an allergic reaction to the dialysate bath temperature. The nurse's action is to evaluate the dialysate bath temperature to ensure it is not too hot, administering an antihistamine, documenting the complaint, and assessing for hyperkalemia are not the initial actions for addressing itching during hemodialysis. Question 14. A patient on peritoneal dialysis presents with cloudy effluent, abdominal pain, and a fever. What is the nurse's priority action? Administer an antibiotic as ordered. B. Assess the patient's vital signs. C. Encourage increased oral fluid intake. D. Document the findings in the patient's chart. Answer 14. B. Assess the patient's vital signs. Rationale: cloudy dialysate, abdominal pain, and fever are indicative of peritonitis, a serious complication of peritoneal dialysis. The nurse's priority is to assess the patient's vital signs to determine the severity of their condition, administering antibiotics, encouraging fluid intake, and documenting the findings are important but should follow the vital sign assessment. Question 15. A patient with chronic kidney disease is prescribed a phosphate binder. The nurse teaches the patient that these medications work by A. Blocking the reabsorption of phosphate in the kidneys. B. Enhancing the absorption of phosphate in the gastrointestinal tract. C. Increasing the excretion of phosphate in the urine. D. Stimulating the production of erythropoietin. Answer 15. A. Blocking the reabsorption of phosphate in the kidneys. Rationale: phosphate binders work by blocking the reabsorption of phosphate in the gastrointestinal tract, reducing its absorption and helping to control hyperphosphatemia in patients with chronic kidney disease. Options B, C, and D do not accurately describe the mechanism of action of phosphate binders.